Okay, let's unpack this. Imagine, maybe you're out gardening, dealing with roses, you get a little scratch from a thorn.
Hmm.
Weeks later, there's this weird bump, maybe won't go away, maybe a few more pop up along your arm. That's a classic way people can get what's known as rose gardener's disease. It's caused by this fungus, Sporothrix.
Right. And, while that's the picture most people have, the sources we've been digging into today show a really crucial side to this story, one that maybe doesn't get talked about enough.
Which is?
Sporothrix isn't just lurking on thorns. It's actually a pretty significant disease in our pets. We're talking dogs and especially cats.
Exactly. Yeah, we've done a deep exploration of clinical guides, vet resources, all focused on sporotrichosis in dogs and cats.
Mhm.
So our mission here is really to pull out the key stuff for you. What is this thing? How do pets get it? How do vets even figure it out? And crucially, the treatment, it's quite a journey, and the risk to humans, that's a big
A
one.
very big one.
We want to give you the essential facts you need.
So at its heart, sporotrichosis is a chronic fungal infection. It's caused by these species in the Sporothrix group. The sources really point to Sporothrix schenckii and one that's becoming more globally relevant, Sporothrix brasiliensis.
Okay, Sporothrix. So how does my dog or cat actually, encounter this? Is it just from digging around outside?
That's definitely a key route. The sources call it traumatic inoculation.
Mm.
Basically, the fungus gets physically pushed under the skin.
Right.
So yeah, contact with contaminated soil, maybe some decaying leaves or mulch, or getting pricked by plant matter that's carrying the fungus thorn splinters, that kind of thing. You can see how, say, a hunting dog crashing through the woods might get exposed.
Yeah, getting poked or scraped while exploring totally makes sense.
It does. But here's something the sources really stress, and it's maybe less obvious.
Mm.
A huge way this spreads is actually from other infected animals.
Whoa, wait. Pets can give it to each other, not just pick it up from dirt.
Absolutely. And this is where cats become really, really important in the story.
Cats are a major source.
They are. The risk factors, yes, include those environmental pokes and scrapes we talked about, but also just being an intact male outdoor cat puts them at higher risk.
Why them specifically?
Well, they're more likely to fight, right?
Yeah.
So bison scratches during a fight can directly inoculate the fungus if one of them is infected and shedding it.
Ah, okay.
So soil exposure is still a factor, sure, but sharing your home with an already infected cat, that's a significant risk too.
So a cat fight could actually transmit this fungus, especially if one has, open sores?
Precisely. Particularly if that cat has the kind of draining lesions we'll get into. That animal-to-animal route with cats really driving it is, well, it's a huge piece of the puzzle.
Okay, so environment or other animals, especially cats. Now, once a pet is infected, what does it look like? Is it always the same?
Oh, not at all.
Right.
And that's part of what makes it tricky. It can show up in several different ways, different forms of the disease.
Okay, walk us through those.
All right, so the most common one, especially in dogs, is called the cutaneous form. This is localized, meaning it pretty much stays near where the fungus got in.
So, on in the skin?
Yeah, you'll see these firm nodules, kind of like lumps or bumps, maybe raised plaques. Eventually, they might break open, ulcerate, and start to drain.
Just a few sores then, maybe?
Could be. But then it can spread. If it follows the lymphatic channels draining that area, you get the lymphocutaneous form. We see this in both dogs and cats.
Lymphatic channels? So it travels?
Kind of, yeah.
Yeah.
It creates these chains of nodules and ulcers that sort of track up a limb or maybe across the body away from that first spot. The nearby lymph nodes might get swollen too.
Ah, I see. So not just one spot, but a trail of sores leading away from it.
Exactly. Then there's the one you really don't want to see, the disseminated form. It's less common, thankfully, but much more serious.
How so?
Here, the fungus actually gets into the bloodstream and spreads through the whole body. It can end up in the lungs, bones, joints, even the brain and nervous system. This is more likely if, the initial skin infection isn't treated, or if the animal's immune system isn't working well.
That sounds incredibly dangerous. Can it hit specific organs without spreading everywhere like that?
Yes, sometimes.
Yeah.
That might be called the extracutaneous form. Like maybe it primarily affects the respiratory system. You'd see things like a runny nose, sneezing, maybe trouble breathing,
Yeah.
or it could settle in bones or joints, causing lameness.
So definitely not always just a skin thing. And you mentioned earlier, cats and dogs can look different, even with the same form.
Yes, this is absolutely critical. It's a major difference the sources point out. Cats are often the tricky ones here.
Ow.
They tend to get multiple lesions, often quite widespread over their body.
Okay.
And these lesions are frequently ulcerated, open, and draining pus or fluid.
Okay.
And here's the kicker. Those lesions in cats typically have a really high fungal load,
Meaning?
meaning there are just tons and tons of the actual fungal organisms packed into those sores. Common spots are the head, the legs, the tail base. And the sources note these can initially just look like wounds from fighting, little abscesses maybe, which again links back to why those outdoor male cats are at higher risk.
And a high fungal load. That's the danger to people, right?
That's exactly why cats are considered the main source of zoonotic spreading into humans. They're essentially shedding large numbers of the fungus from these draining sores.
Okay, that makes the cat situation very clear. What about dogs? Are they different?
Very different, generally. Dogs usually have more localized disease, either that cutaneous form or maybe the lymphocutaneous form tracking up a limb, often on the head, the nose, the ears or limbs, or the body.
Than the sores themselves.
They're typically less exudative, meaning they don't drain as much fluid or pus. And critically, they generally have a significantly lower fungal load compared to cats. Finding the actual fungus in dog lesions can be tough.
Fewer organisms, less drainage.
Right. And systemic or disseminated disease, where it spreads internally. Much rarer in dogs.
So dogs tend to keep it more contained, less messy sores, fewer bugs in the sores. That must make a huge difference for diagnosis and also the risk of spreading it.
Absolutely. That difference in fungal load is fundamental to understanding the challenges in diagnosis and the difference in zoonotic risk between the two species.
Right. So speaking of diagnosis, how do vets confirm it's sporotrichosis? It sounds like it could mimic a lot of other things.
You're absolutely right. And getting an early, accurate diagnosis is so important, not just for the pet's treatment, but, as we keep saying, especially for preventing human exposure.
What tools do they use? How do they figure it out?
Well, a common first step is cytology. That's where the vet takes a sample from a lesion, maybe with a cotton swab if it's draining, or by sticking a small needle in to get some cells.
Like a fine needle aspirate.
Exactly. Then they smear it on a microscope slide, stain it, and look at it under the microscope.
Okay.
And here's where that cat-dog difference pops up again. Cytology is often diagnostic in cats.
Because of the high fungal load?
Precisely. Because there are so many organisms in those cat lesions, you can frequently see them right there on the slide, these characteristic little oval or cigar-shaped yeast cells. Sometimes they're even inside the inflammatory cells.
So for a cat, a quick look under the scope might give you the answer.
Often, yes, but,
Oh.
and this is a big but in dogs, it's much harder.
Why? Just fewer organisms.
Exactly. Because the fungal load is so low in most dog lesions, doing cytology is often, well, the sources say, challenging and frequently unrewarding. You can look and just not find any fungal organisms, even if the dog definitely has sporotrichosis.
So if the cytology comes back negative on a dog, it absolutely does not mean they don't have it?
Correct. You cannot rule it out based on negative cytology in a dog. They typically use stains like Romanowski stains, Wright stain, Diffquick, that kind of thing, to help see the cells.
Okay, so if cytology isn't always the answer, especially for dogs, what's the best way, most reliable way to confirm it?
The sources consistently point to fungal culture as the gold standard.
Growing it in the lab.
Yep. You take a sample, could be fluid from a draining lesion, a small piece of tissue from a biopsy, or fluid from an aspirate, and you send it to a specialized laboratory. You put it on special media to see if the Sporothrix fungus will grow.
That makes sense. Confirms the actual organism is present. Anything special about sending samples for this fungus?
Yes. This is absolutely critical, a major safety point. You must tell the laboratory that you suspect Sporothrix.
Why? Just standard procedure?
No, it's because of the high zoonotic risk, especially with samples coming from cats. The lab staff need to know they're potentially handling highly infectious material so they can use enhanced safety precautions, like working at a biosafety cabinet. It's not just a routine culture submission.
Wow. Okay, that is really important for vets or techs sending samples. Warn the lab. What other tests might be used?
Histopathology is another common one. That involves taking a larger tissue sample, a biopsy, preserving it, and sending it to a pathologist who slices it thin, stains it, and examines the tissue structure under the microscope.
What does that show?
It shows the type of inflammation happening in the tissue, which can be characteristic. But same issue as cytology, especially in dogs. The fungal organisms themselves might be present, but very scarce.
So hard to see.
Right. They often need special stains, like PAS, periodic acid Schiff, or GMS, Grocut's methenamine silver, which specifically stain fungi, making them easier to spot.
Yeah.
But again, even with special stains, if you don't see organisms on a dog's biopsy, it doesn't rule out sporotrichosis.
Dogs are just really good at hiding this fungus in their tissues, it seems. makes diagnosis tough.
It appears that way, likely due to that lower fungal burden compared to cats. Other more advanced methods include PCR.
Molecular testing.
Yeah, PCR tests look for the fungus's DNA. This can be really helpful not just for detection, but also for identifying the specific Sporothrix species involved. Knowing if it's Aspergilliensis, for instance, is important in areas where that species is common because it can affect the treatment plan and the outlook.
So PCR can tell you exactly which type of Sporothrix it is.
Interesting. Anything else? Lastly, there's serology. These are blood tests looking for antibodies the pet's immune system has made against the fungus. Tests like ELISA are available.
How useful are those?
They seem to be most useful in cats, maybe as a screening tool or just another piece of evidence supporting the diagnosis. It shows the cat has been exposed and reacted. They're less well studied or validated for routine use in dogs.
So it sounds like diagnosis often involves putting pieces together, the clinical signs, maybe cytology if you're lucky, especially in cats, and ideally, confirmation with fungal culture while always remembering to warn the lab.
That's a good summary. And maybe histopathology or PCR in certain cases.
Okay, so once you have the diagnosis confirmed, let's talk treatment. What does that involve? Is it straightforward?
This is where the real commitment kicks in. The absolute core principle is that treatment requires a prolonged course of systemic antifungal medication. We're talking drugs that treat the whole body, not just creams or lotions.
Prolonged. Okay, define prolonged. Weeks. Couple of months.
This is probably one of the toughest parts for owners and a critical point from the sources. Treatment must continue for at least 1 full month after all the clinical signs have completely resolved.
Wait, say that again? A month after the pet looks totally fine, the sores are gone, everything looks normal, but you keep giving meds for another month.
Exactly. A minimum of 1 month past apparent clinical cure.
Why? That seems counterintuitive.
Because this fungus is sneaky and persistent. Relapses, the infection coming back, are incredibly common if you stop treatment too soon. Even when the skin looks healed, there can still be fungus hiding out at low levels.
Okay.
So that minimum 1 month after clinical cure often means the total treatment duration is very long. For dogs, you're typically looking at 3 to 6 months, sometimes longer. For cats, well, for cats, it's very often longer than 12 months.
A year. Over a year of daily medication.
Especially if the cat has that Aspergilliensis strain, which tends to be more stubborn. Yes, potentially over a year.
Wow. That is a massive commitment. This is absolutely not like a 10-day course of antibiotics.
Not even close. It requires serious dedication from the owner. The main drug, the one recommended as the first choice in the sources, is itraconazole.
Ketoconazole. Okay. How does that work?
It's an antifungal drug, part of the azole family. It works by messing with the production of ergosterol, which is a vital component of the fungal cell membrane. Basically, it damages the fungus's outer layer.
And how is it given?
It's an oral medication given by mouth. The dose is usually somewhere in the range of 5 to 10 milligrams per kilogram of the pet's body weight, given once a day.
Anything special about giving it, like with food or empty stomach?
Yes, good question. For the capsule or tablet forms, it's generally recommended to give it with a meal. Food significantly helps the body absorb the drug.
Okay, with food.
The oral solution form might be a bit different. Sometimes it's absorbed better on an empty stomach, so you'd follow the specific instructions for that product. Also, the capsules need stomach acid to be absorbed properly, so you generally want to avoid giving antacids or acid-reducing medications around the same time unless you're using that oral solution.
Got it. Good practical tips. So long-term meds, often over a year for cats, give capsules with food. What about side effects? Anything to watch for with such long-term use?
Yeah, like any medication used for months, there can be side effects. The most common things owners might notice are related to the stomach, maybe loss of appetite, some vomiting, or diarrhea.
Oh, okay.
Because it's processed by the liver, there can be effects on liver enzymes, especially with long-term use. So regular monitoring with blood tests is important.
What else?
Less commonly, especially at higher doses in dogs, it can cause inflammation of blood vessels, something called vasculitis. And some sources mention cats occasionally developing facial itching.
Okay, so regular vet checkups and blood work are definitely part of managing this treatment. Any advice on the specific type of itraconazole to use? Does it matter?
It actually does. The sources really emphasize using the FDA-approved veterinary formulations, the brand name capsules, or the oral solution. They caution against using compounded itraconazole powder.
Why is that? Compounding is common.
Because the absorption of compounded powder can be really erratic and unreliable. It might not reach effective levels in the bloodstream, meaning the treatment could fail just because the drug isn't getting absorbed properly. So stick with the approved forms.
That's a really important point about formulation. Okay, so itraconazole is the go-to. What if it's not working well enough, or maybe the pet can't tolerate it? Are there alternatives?
Yes, terbinafine is often the next step. It's another oral antifungal. It also targets the fungal cell membrane, but through a slightly different mechanism than itraconazole.
How is terbinafine typically used?
It's usually dosed around 30 milligrams per kilogram of body weight, once daily for both dogs and cats. It can be used on its own, especially for maybe milder skin-only cases, or it's often used in combination with itraconazole for more severe infections, or cases that aren't responding well to itraconazole alone.
So it can be an alternative or a partner drug.
Exactly. It's generally quite well tolerated. Maybe some mild stomach upset is the most common side effect seen.
Okay, good to have options. Were there older treatments used before these came along?
Yes, the historical treatment you might hear about is potassium iodide, often abbreviated as Ki or SSKI, saturated solution of potassium iodide.
Potassium iodide, how does that work?
Its exact mechanism against Sporothrix isn't perfectly understood, but it seems to interfere with the fungus's metabolism in some way. It's used much, much less commonly now, though.
Why is that? If it worked.
Primarily because the newer drugs, like itraconazole and terbinafine, are generally safer and more effective. Potassium iodide comes with a significant risk of side effects.
Is it ever used today?
Maybe occasionally, perhaps as an add-on treatment in really difficult, non-responsive cases, or sometimes if cost is a major issue because Ki is inexpensive. It's given as a liquid mixed with food, and the dose has to be increased very gradually. But, and this is critical, you have to use extreme caution with potassium iodide, especially in cats.
Extreme caution. Why? What happens?
Cats are very sensitive to iodide toxicity. It causes a condition often called iodism.
Iodism, what are the signs?
It can be severe. We're talking serious stomach upset, depression, drooling excessively, muscle tremors or twitching, a drop in body temperature. It can even lead to collapse and potentially death in cats. Plus, it reportedly has a horrible metallic taste, making it very hard to get pets, especially cats, to take it willingly.
Wow. That sounds genuinely dangerous, particularly for cats. Okay, so definitely not a first-line choice anymore. Understood. What about those really severe, life-threatening cases? The disseminated ones?
For those really critical cases, or maybe ones that just aren't responding to anything else, amphotericin B might be considered. It's a powerful antifungal, but it also comes with significant toxicity concerns.
So like a last resort.
Often used just for initial stabilization in very sick animals, yeah. Because its main side effect is kidney damage.
Kidney damage, that's serious.
Very. So if amphotericin B is used, intensive monitoring of kidney function through blood tests, BUN creatinine, is absolutely essential. There are newer lipid-based formulations that are a bit less toxic to the kidneys, which are preferred if available. And it has to be given intravenously, usually in the hospital.
Okay, so that's the real heavy hitter for dire situations. Any other drugs on the horizon?
One source did mention milteforan. It's a drug used for some other conditions, but it's apparently showing some promise in treating feline sporotrichosis, especially the S. brasiliensis type. So maybe an emerging option for specific difficult cases or in certain regions.
Interesting. So the big picture on treatment, itraconazole is usually number one. It's a marathon, not a sprint, often months, maybe over a year for cats. Give with food usually, watch for side effects, use the right formulation. Terbinafine is a good backup or partner. Ki is mostly historical due to risks, especially in cats. Ampho B is for emergencies.
That's a really good summary. And don't forget adjunctive therapies, meaning things you do alongside the main antifungal drugs. Basic wound care for the skin lesions is important, keeping them clean. For very localized single lesions, maybe things like surgical removal or cryotherapy, freezing, or even localized heat therapy might be considered by the vet.
But those wouldn't cure it alone, right?
Absolutely not. The sources are clear. These local treatments should always be done in conjunction with the systemic antifungal medication. You can't just cut off the lump and call it cured. The fungus is likely elsewhere too.
Right. Address the local sore, but the pills are doing the heavy lifting systemically. Okay. We keep emphasizing how long the treatment is. How do you actually know when it's truly safe to stop those meds?
This brings us back to that crucial concept of mycological cure. It's not just about when the pet looks better.
Okay, mycological cure. Explain that.
So remember, we said you have to treat for at least 1 month after all the clinical signs are gone.
Right. Minimum 1 month past looking normal.
Yes. But the ideal goal, the true confirmation that the fungus is gone, is achieving mycological cure. And you confirm that through testing.
How? More blood tests.
No, it's done using repeat fungal cultures. You take samples again from the areas where the lesions used to be.
Even after they look healed.
Yes. The recommendation is generally to do these repeat cultures every 1 to 2 months during the later stages of treatment. You continue the antifungal medication until you get negative culture results, meaning no fungus grows for at least 2 consecutive cultures, typically taken a month or 2 apart.
2 negative cultures in a row from the site of the old sores months after the pet looks fine.
That's the goal. That confirms mycological cure and gives you the best confidence that it's safe to stop the medication and that relapse is less likely.
Wow. That really drives home how persistent this fungus is. Okay, so monitoring involves the vet checking the pet regularly, looking at the lesions and these repeat cultures. Anything else?
Yes, ongoing laboratory monitoring is usually needed too, especially with these long-term drugs. We mentioned it briefly with side effects, but regular CBCs, complete blood counts, and biochemical panels are standard.
What are you looking for there?
Checking liver enzymes, especially if the pet is on an azole like itraconazole. Checking kidney values, particularly if amphotericin B was used at any point. Also, just monitoring overall health, red and white blood cell counts. It helps catch any potential drug side effects or other complications early.
Makes sense. What happens if a pet just isn't getting better, even after several months of, say, itraconazole?
Those are the tough ones, the refractory cases. The first thing the vet will do is step back and reevaluate.
Like what?
Is the diagnosis 100% correct? Could it be something else mimicking sporo? Is the owner actually giving the medication correctly and consistently? Compliance is huge with such long treatment. Is the drug even being absorbed properly? Sometimes they might check blood levels of the drug.
Okay, rule out those issues first.
Right. If all that checks out and the pet still isn't responding, then the vet might consider switching to a different antifungal, or, more commonly, using a combination of drugs, like itraconazole and terbinafine together.
Trying to hit it from multiple angles.
Exactly. And are there other factors that make treatment inherently more difficult?
Yeah, are there things that make it harder from the start?
Definitely.
Wow.
If the pet has a weakened immune system, for example, a cat that also has FILV, feline leukemia virus, or FIV, feline immunodeficiency virus, or any pet that's on immunosuppressive drugs like steroids for another health problem.
Like allergies or autoimmune disease.
Right. Treating sporotrichosis in those animals is much, much more challenging. Their body can't help fight the fungus effectively. The prognosis in these cases is usually worse. If possible, addressing the underlying immunosuppression is important, but that's not always feasible.
Okay, so it's a long road, potentially expensive, complex treatment, requires intense monitoring and real owner dedication. Given all that, what's the general outlook? What's the prognosis for a pet diagnosed with this?
It really varies. It depends heavily on the pet, the form of the disease, and even the specific fungus.
Let's break it down. How about for dogs? What's the usual outlook?
For dogs, generally speaking, the prognosis is considered good, provided they get appropriate long-term treatment. Remember, most dogs get those cutaneous or lymphocutaneous forms, which tend to respond pretty well.
That's encouraging for dog owners. What about cats?
For cats, it's more guarded to good. It's more variable. It really depends on how severe the disease is. If it's disseminated, spread internally, the outlook is much worse. And as we mentioned, the specific Sporothrix species matters a lot in cats.
Right, that S. brasiliensis.
Exactly. Infections with S. brasiliensis in cats often behave more aggressively, they need even longer treatment, and unfortunately the rates of treatment failure or the infection coming back after treatment stops are higher compared to S. schenckii infections.
So the specific type of fungus really changes the odds for cats. And what about those severe disseminated forms, regardless of species?
For disseminated forms in either dogs or cats, the prognosis is pretty consistently guarded to poor. Those cases where it's spread internally are just much harder to control and cure.
Okay, so localized skin lymph node disease in dogs, generally good outcome with proper care. Cats equals more variable, depends on severity and the fungal species. Systemic disease, always a serious worry. We've covered the pet side really thoroughly, but let's circle back hard to what you called the biggest takeaway, the risk to people.
Yes. This is honestly the single most critical public health message related to this disease based on everything we've reviewed. The zoonotic risk, the potential for it to spread from animals to humans, is high, particularly from infected cats with those draining skin lesions. It cannot be emphasized enough.
And you said earlier, it's not just if you have an open cut, right? How easily can it transmit?
The sources are quite clear. Transmission can potentially occur through direct contact of the exudate, the fluid draining from the sores with intact skin. You don't necessarily need an obvious break in your skin to be at risk, although cuts and scratches certainly increase the risks significantly.
Wow.
This is why strict hygiene and the use of personal protective equipment, PPE, are absolutely mandatory for anyone handling or caring for an infected pet. That goes for veterinary staff and for the owner at home.
What does that mean practically? If I'm the owner caring for my infected cat, what do I have to do?
Okay, the guidelines are very specific. Number one, always wear disposable gloves when handling the cat. Always. Especially when cleaning lesions, putting on any topical meds, or even giving oral meds if there's a chance of contacting saliva potentially contaminated with exudate.
Gloves, always. Got it.
Number two, wear long sleeves, maybe even an apron or gown to cover your arms and clothing. Protect your skin.
Cover up. Okay.
Number three, avoid any direct contact between your skin and the fluid draining from the sores. Treat that fluid as highly infectious.
Avoid the goo. Makes sense.
Number four, wash your hands thoroughly with soap and water immediately after any contact with the pet, after cleaning their bedding or litter box, or after giving medications. Even if you wore gloves, wash your hands afterwards.
Gloves plus hand washing. Crucial.
Exactly. And number five, do everything possible to prevent bites and scratches from the infected animal.
Wow.
An Elizabethan collar. The cone of shame might be necessary, especially for cats. It stops them from licking or biting at their sores, which could spread fungus to their mouth or claws. And it also helps prevent them from biting or scratching you.
Okay, cone might be needed for safety. What about managing the cat in the house?
Infected cats should be kept strictly indoors. This prevents them from potentially spreading the fungus to other animals outside or further contaminating the immediate environment.
Indoors only.
And ideally, they should be kept separated from other pets in the household, especially other cats, to prevent transmission within the home.
Isolate, if possible. Wow, that is a lot for an owner to manage day in and day out for months. Communication from the vet must be key here.
Absolutely paramount. The vet needs to clearly and compassionately educate the owner right from the start about the infectious nature, the real risk to humans, the sheer length and commitment required for treatment, and the potential for relapse. Owners need to understand why all these precautions are so vital.
And what if the owner does notice something suspicious on their own skin while caring for their pet?
This is the critical call to action for owners. They must be strongly advised, urged, really to seek medical attention from their own human doctor immediately if they develop any unusual skin lesions. Things like persistent bumps, nodules, sores, especially on their hands or arms, after handling their infected pet.
Go see a doctor right away.
Yes. And it is absolutely crucial that they tell their doctor that their pet has been diagnosed with Sporotrichosis. Making that connection is essential so the doctor considers Sporotrichosis as a possible diagnosis for the person's skin issue.
That is such vital advice. Tell your doctor about your pet. Okay, what about the environment? Can you clean the house to get rid of the fungus?
Well, trying to minimize the pet's exposure to specific areas where they might have picked it up, like certain patches of soil, is sensible, though hard to do perfectly. As for disinfecting their home environment, the sources suggest that disinfection, maybe using a dilute bleach solution like 1 part bleach, 10 parts water, on surfaces that might have been contaminated with exudate, could help reduce the fungal load. But Sporothrix can be hardy, and completely eliminating it from the environment is very difficult.
Yeah.
The main focus has to remain on successfully treating the infected pet to eliminate the source and using rigorous personal protection to prevent human exposure during that long treatment period.
Right. So treat the pet, protect yourself. Those are the priorities.
Precisely.
Well, this has been an incredibly insightful deep dive. It really shows sporotrichosis is way more complex than just, a gardener's nuisance. We've unpacked what it is, the big differences in how it looks, and how hard it is to diagnose between cats and dogs.
Especially those diagnostic challenges in dogs.
Right. And the really demanding long treatment protocols, the guarded prognosis for the bad cases.
And wrapping it all up, that absolutely critical zoonotic risk, especially from cats, and the non-negotiable need for strict hygiene and prompt human medical care if someone gets exposed or develops lesions.
It really leaves you with something to chew on. Thinking about how Sporothrix brasiliensis, which was mainly a South American issue, is now popping up more and more around the globe. How does that change how we need to think about this disease? Does it mean we need to be more vigilant, even in places where it used to be rare? What does the spread of a fungus like this really tell us about how connected animal health, environmental health, and our own health truly are in this, increasingly connected world?